I usually tell the patients that now that the bladder has kind of shrunken down to much smaller volume because of their chronic incontinence and the bladder not being, having have chance to expand and, store urine to its usual capacity. Most adult average bladder capacity may be around 300 or even more. So your bladder is much smaller, so you will have more frequent urge to use the washroom. But as the bladder is a very compliant organ, it will reassume its normal size pretty quickly. But for the first few weeks, they may experience a little more frequent urge to urinate, and that's good. That's so that the patients should plan on using their sphincter every 2.5, 3 hours, and open up the sphincter so that you can urinate. In fact, when the patients do come back, and another potential complication that I didn't mention is that a person may experience persistent urinary incontinence, but then oftentimes it's either that they don't have stress incontinence, but now they have urge incontinence, and their bladder spasm is so strong that the urine is actually forced past the sphincter that's perfectly functioning fine. Or, so I think that, opening the sphincter every 2.5, 3 hours during the first few weeks is going to be critical in helping the patients to become familiar with the use of the device, and also to make sure that they're not bothered by, increased frequency and urgency with a sphincter placement.